We thank God we are alive.
Right. Well, tell us what you've been up to. I mean, what's making it busy? Feel free to share. This is your space.
As we all know, COVID is here, and we know that from different countries what they've done that has been successful. We know that the spread is reduced when we wear masks. So today I've been going around trying to get masks made. Medical Women's Association of Ghana, we have, since this COVID-19 came, we started this thing called Project Hope. And there are 4 arms under the Project Hope. One is, patient education or public education. Then there's one that has to do with Feed the Needy. And then the mask COVID out. That's the one I'm part of. And so what we're trying to do is to just, educate everyone and tell everyone in Ghana that we have to be able to wear our masks so we can mask it out. And in the same vein, we are also, trying to get donations so that we'll be able to make masks that we can share and give freely to the needy and the vulnerable. So that's what we've been up to.
It looks like a lot of work for people who are already at the front lines like yourself, dealing with sick people who nobody knows may have or may not have coronavirus, adding up, the work of public education, of masking it out, of feeding the vulnerable. May I ask why the Medical Women Association of Ghana, for example, decided to add this task to your already daunting task in these times?
Yes, thank you. So Medical Women Association of Ghana, we are part of the Lady Doctors of Ghana. And we work in hospitals. Most of us are, frontline workers, as far as, working at OPDs, seeing the undifferentiated patients. And so we see what goes on, and we know firsthand what our medical capabilities are as far as infrastructure and, the health system. So we thought that, well, how best can we help the situation? We could, try to limit the number of cases by educating and by doing, talking about or highlighting the preventive measures that we can do to reduce, the number of people who get it, who end up getting it and coming, so that at least our meager resources so far would be able to cater for some of them. So really, in that sense, we thought, okay, let's get Ghanaians healthy, let's get Ghanaians protected. At the same time, then we'll have less people coming to hospital, and then whatever little we have, we'll be able to manage those who end up coming.
Essentially, dousing the flame from wherever it is before it escalates. And hopefully there'll be, and hopefully there'll be well-meaning Ghanaians, I believe there are, who would be willing to help. How can people help?
Well, so far we had said that we wanted donations in either fabric or, you have time to sew, if you want to sew for us for free, to help, or even money. And I must say, some people have donated, there are well-meaning Ghanaians, there's, someone gave a lot of fabric, for us and to use, and people have been donating money and some of the
yeah, it looks to me like someone is calling Dr. Banker's phone. I think someone was calling your phone. People do that when they see us on TV, don't they? That's okay. So let's continue from where you left off. You said that you received some donations, people who are willing to give you fabric, people who are willing to sew for you. You're asking people who are willing to sew for you to come on board. Please take it from there for us.
Yes, so because of course, we can't just use any masks. So we've done research, looking into what's the best homemade mask that can be made, because we know that the N95 is what we use in hospital, and that one is not for non-clinical use. So the next best thing would be able to design a mask that would be protective. I mean, it would definitely not be as protective as the N95, but at least it will get up to about 70% protection. So we did our research, and we've come up with, how the masks are supposed to be like, to give the layperson some protection. And then we've come up with videos on how to make those masks that we've sent out. Everybody sent it to their contacts. And and also another thing that's very important is that wearing the mask is as important as taking it off, because you can protect yourself all day. But when you do go to take off your mask, you end up infecting yourself if you don't do it the right way.
Sure.
So we have made videos to that effect, and also, sent it out, to all our contacts that, wherever you buy the mask, it has to, first of all, be the right mask. And then you have to, take it off in a proper manner and, wash it or sanitize it properly, and then you can put it back on.
I would love to have those videos so we can also share it, especially on this segment that we've created that's essentially focusing on frontline workers like yourself and how we can help make your work easier, how we can be there for you, celebrate you so you can keep on with the hard work. Because it's interesting that you mentioned the research that you have done that has gone into the creation of these masks. Because just this afternoon, we're having a conversation about the level of efficiency of the fabric mask. Do you want to throw some light on that for us?
Yes, so we did take our masks to the FDA, and some of the things, the advice that they gave us, was that the mask, the inner lining that touches your nose and your mouth should be plain fabric. Because if you use any colored or any printed fabric, the dyes in there, you end up inhaling that, and that is not very healthy.
Okay.
So that was one of the reasons, that was one of the things that, we came away with. And we found out that if you use the interface fabric, it gives some protection. And that interface fabric is what we commonly call stiff. Okay. That we use, and they call it cover stiff or whatever.
Yes.
And there are different grades of it. So you have the soft one, the medium one, and the hard one. So for everyday use, we can use the soft one. The medium one, it's a little bit challenging to breathe through, but that we could use in a clinical setting, but not with a COVID patient. So that's so really, we know that, like I said, the ultimate is N95, and people are walking around with N95 who don't need it and who would end up even contaminating themselves because they are not wearing it properly. Wearing an N95 and walking out in this hot sun, you won't be able to keep it for more than 10 minutes. You take it off. And we know also that you shouldn't be touching your masks once you put them on. So hopefully the homemade mask will be safer if you learn how to use it properly, as far as taking it off and sanitizing it well. And then it would also, it's reusable. So, you don't have to keep getting a new one each time. A lot of the masks that people are using out there, the surgical masks, they're actually disposable. You're supposed to just wear them once and throw them away. But you know that we are strapped. So a lot of people just keep that one mask all the time, and it's not the best. So hopefully we're hoping that our campaign will also release more N95s for the use of the clinical workers who really need it.
Okay. Well, I'm hoping that we'll be able to engage you more here with the education, very good education you've given us this afternoon. I think that we should, speak about it over and over again, the use of these masks, how efficiently you can use them, so that they will be helpful rather than dangerous to your health at the end of the day. And I'm also very excited about your advocacy, and I'm hoping that we'll be able to partner you to make it much more effective. You spoke about how people can help by helping you to sew the masks, by donating fabric, by donating even if it's money. But how can people do so when they want to?
Oh, we do have a poster I could actually send you later with a Momo number.
Okay.
And then we have some contacts on there where you could call. So you can call, and then whatever you want to, we can make arrangements for that. So
you can share with us the Momo number, and then we will share the poster much later when we have it. We can put it on the screen for people to see. Whilst you look for it, though, there's a very interesting part of the conversation that I always love to have with health workers like yourself. How has your life changed? I mean, on a very personal level, if you don't mind us asking, since COVID-19.
Oh, wow. Yeah, COVID has really, it's really brought some changes. So, coming home, usually come home and it's, you just walk through the front door, go and wash your hands, and then, get on with life. But now you can't do that, so for me, my routine is, we have a Veronica bucket in front of the house. My husband is a doctor also, he's a neurosurgeon. So we come into the house, we come to the front of the house. When we park our cars, we just wash our hands, and then we go through to the back, take off our shoes, and then go straight into the bathroom. Have your shower before you come out. And our son knows that, he's not supposed to come close until we've had our bath. So sometimes when you are talking, he will ask, have you had your bath? Corona, have you had your bath? So it's kind of something that it's become, life-chinging. And also, washing hands regularly and using your hand sanitizer. It's been something that we did it, but then now we are a little bit more conscious of it. Because that's really the main thing. We know that the virus can be on your fingers for some hours. Yeah. So washing hands is really the best. We talk about hand sanitizers. It has to be alcohol based, and even that, if the alcohol content is less than 60%, really, it's kind of dicey. So it's been interesting. And also I miss my patients too, because right now we don't have regular OPD where people just come in and, usually you have, elderly people who come, they are just coming for their drug refills, but they just want to chat and tell you about what the grandson is doing or, stuff like that. And you don't have that anymore, So that, you miss that too. And then you really hope that those who have chronic illnesses like hypertension and diabetes, you wonder, how are they keeping? Are they eating well? Are they getting their refills? Are they getting medication they need? So it's really changed the practice of medicine as far as the outpatient care is concerned.
Okay, I was just going to ask you but you've answered that question for me already about how your interaction with your patients, whether or not they've changed, because right now you don't know who has it, who doesn't have it. People are asymptomatic, so when you even at the OPD level, you don't know, which I think you've answered. We'll take our time and go into details when we have another chance with you here on Frontline. But did you get the Momo number? Otherwise, we can always do it, say, tomorrow, if you get it tomorrow.
Yes, I will get it for you. Okay. I don't have it.
No problem.
Ready.
No problem at all. Let's put it together and then we'll share it with our viewers tomorrow, and we'll try and do that more constantly so a lot more people will see, so they can contribute if they want to. Doc, thank you so much for your time this afternoon. I've just been talking to Dr. Betty Banker. She's head of Adolescent Clinic, and she is also a member of the Medical Women Association. She works at the Greater Accra Region Hospital. As you know, one of their colleagues had coronavirus. We'll get some time to talk to her about that specifically and how they feel, those who work there, and how they feel about that as well. But you can donate to them. I think that if you go on there, so they'll certainly have a social media platform. You can go to the Medical Women Association of Ghana, see how we can help them together. We're still on the front line. Now, the Christian Health Association of Ghana is condemning what it calls cruel treatment meted out to health workers who attend to COVID-19 patients. The association, with over 300 member hospitals, say they are already receiving reports of stigmatization of frontline workers at the hospitals where COVID-19 patients have been admitted. Chief Executive Officer of CHURC, Peter Yeboah, says it's rather unfortunate that frontline health workers who daily put themselves in harm's way attending to COVID-19 patients will be stigmatized instead of being celebrated.
As I speak to you now, some CHURC facilities are treating COVID-confirmed cases